If you're going to use a medication, you need to be doing the other things as well, if at all possible, setting up a routine and being consistent and figuring out what's soothing. The other thing I would add is getting up at the same time as well. Because, if you get up at 10 o'clock on Saturday and 6 o'clock on Monday, your whole sleep pattern is disrupted. And one of the things that our body starts producing when it starts to get dark is this thing called melatonin, which is a hormone that's produced in the brain by this little gland that sits on the top called the pineal gland. And as the day goes through and it starts to get dark and you start to feel sleepy, one of the things that's making you feel sleepy is this surge in melatonin. And what we think is happening in at least some of the kiddos and people who have autism spectrum disorders is that normal cycling of hormones that includes melatonin and steroid hormones and a whole set of other things is disrupted and it isn't happening in a routine kind of way. And so if you're working with a family where they're saying, you know what, we're doing everything we can do and we're working really hard to get these structures and routines set up and it's really not working, then one of the things you can think about doing in addition to all of the other behavioral stuff is to use a medication. Now, melatonin isn't a medication as such. It's actually sold as a food supplement, but there are some side effects to it. One of the big ones is that it can cause sleep disruption in itself. So you get some people who are really groggy and start sleepwalking or bedwetting or whatever. It's not an entirely, just because it's natural doesn't mean it's benign. On the other hand, it's something that a lot of us with disrupted sleep cycles will use and find really helpful. And a lot of parents of kiddos with autism will find it helpful as well.